So, students, today we are going to practice the questions and we are going to learn how to, how we are ready. Like, basically, what I want you to go do is make the mistakes, right? So that we will learn that how to improve, what is the common mistake students do. And it is very important because I will teach you in the strategies classes that avoid these things, mistakes, and how to do the SATA question, etc. So I hope this lecture is going to help you a lot. And we are going to revise all the syllabus with the help of like when we are doing the questions. So, students, let us do the U word. I'm creating the test on the U word. Okay. And that will be the platform we are using. And we will try to, like, for a couple of questions, I will do. Okay. Then I will start asking the question from you guys. Okay, so the first question, whenever I will show you, I want you to take couple of minutes, maybe 2 minutes I will give you, and we will see that what is the difference between like how you should approach versus how Alveen is approaching and you are approaching, and you can just learn from that. Okay, because you guys are on this screen, maybe my face will be on this screen because my U word is in this. Okay, so excuse me for that. So let me share the screen. Can you see the screen here?
Yes, ma'am.
All right. So students have read this question and do the question on your own first, and then I will take it from there. And you guys can give me the answer in the personal message that what do you think is the answer?
Ma'am, where I need to send?
In the chat box. You will
Like same I send it before. Like I will send like 2, 3, 4. Is that right?
yes, 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 yes.
Okay. Okay. Thank you.
Okay, so let's do this question. I am reading this question. The nurse initiates the prescribed IV therapy on 86-year-old hospitalized client. Which lifespan concept should be considered when initiating the IV therapy and caring for older adult receiving the IV therapy? So the question they are asking me is that how the IV therapy, how to initiate the IV therapy for older clients. Okay. And whenever we are doing this one, the SATA question, you must realize that you should approach it as a true false. How to approach it? Let me show you. Avoid infusion devices in confused client as the alarms can be disruptive. That like for the old clients who are who are very confused, don't initiate the infusion. That is not good for them.
False.
Is it true?
No, it's false, ma'am.
It is false. So
False.
it should not be the answer. False, I'm not going to. Cardiac and renal changes may put the client at risk of hypervolemia. So old people, when they're receiving the IV therapy, do you think they have the risk of overload because of the cardiac and their kidney issues? Is it linked?
Oh,
I am thinking that is when I'm doing the IV therapy, is it linked with the cardiac system? Yes, it is.
yes, because accumulate the fluid, overload the
Yes, the
fluid.
accumulation of
Yeah,
the
accumulation.
fluid, right? You can hear the crackles. Is it linked with my kidneys? If your kidney is
Yes.
failed, do you think I
Yes,
should give the
yes,
IV fluid? Yes, also.
yes, yes.
Yes, ma'am.
Like that is also.
Waste products.
So this
Okay.
one should be good. Older adult may have more fragile veins.
Yes.
Yes, ma'am.
But let me read the full sentence. Increased risk of infiltration. Yes, they are fragile veins, right?
Yes.
Yes, this is also true. Skin protectants and non-porous tape are helpful in reducing the skin tear. They are talking about the skin tear. Do you think the skin protectant is helpful? Yes, it is
Yes.
going to helpful. Non-porous tape, that tape which is not very sticky, is it help to prevent the skin tear? It is also
Yes.
helpful. Is it false? No, there is no
True.
harm
True. True.
in tape. It is also true. Use 30 to 45-degree angle. Yes, we are doing on the insertion, like when we are doing the IV, because older adults have deeper veins. But wait. Deeper veins, they, whenever you will see the older clients, their veins are on the surface. If you see your grandparents or something, you will see their veins literally on the surface. It is not deeper. This is the wrong word.
In the yeah, I saw the visible vein. Like most
Visible
of the
vein.
visible
Okay,
veins.
so yeah, 30 to 45 degree angle is not bad, but it is not deeper. It is very superficial. In fact, sometimes we have to maybe use 15, 20 degrees. It is very superficial, right? So that is false. Deep, it is not deep. So let us try. And that is the correct answer. Okay, that is how you should read each option and think about it. Okay, let's do the second question. This is okay, which is a positive sign of pregnancy, right? So let me see how many of you guys will do it correct, and then I will take it from there. I will see if I can put my
What is the report of the movement and equalize which
Okay,
even
students, I don't want you to be very loud because everybody, you should respect everybody else, right? Okay, let me see. Okay.
Rich, please lower the volume, please.
Okay, students, everyone. So clients suspect she is pregnant and comes for the prenatal evaluation. Which of the following assessment finding indicate positive sign? Okay, I think you guys should know this answer, the positive sign. What is positive? Positive means that definitely there is baby. Okay, so always choose positive sign related to the baby, the fetus. If there is heart rate or anything that is not related to the mother, not about the vomiting, choose the things which is related to the fetus. Okay, cervical softening on examination. It can happen in other conditions also, right? It is not that she's positive pregnant. I have to do the test. No. Fetal heart tones. There is a fetal heart
Yes.
tone. I hear the fetus. Yes.
Yes.
Positive serum HCG test. It can be happening in other diseases, in other problems also. It doesn't mean that it's
False.
also positive, right? It is a false, yes. Report fetal movement. She is feeling that there is a fetus movement, but do we all 100% sure? Not really,
But this is too early. I think this is false, right?
right? Okay, this is not. Report the fetal movement. No, I have to check on you. Visualize it. I saw the fetus.
Yes, true.
Okay, this should be the one. Anyone has different options? 2-5 was the answer. 2-3, Ruby. I hope you got your answer here. Okay, let me see. Okay, the next question, everyone. This is my topic, so let's see. Okay. Ready, guys? And see that how you guys are doing. The nurses provide teaching about potential pharmacological interaction to the client diagnosed with AFib who is prescribed warfarin. Which statement by the client requires follow-up? Follow-up means that what he is doing wrong. Okay? AFib and warfarin he is on. Most of the time when they are talking about the follow-up, it is related to the medication, and we have discussed the medication. Let us see how many of us are correct. I need to avoid eating green leafy vegetable while taking this medication. Okay, that I am not eating the green leafy vegetables. Avoid means fully avoid. Should I avoid eating the green leafy vegetable?
No, limit.
No.
Why? Why?
Because
We should avoid
Why? Okay, both of you.
because green leafy vegetable has
Vitamin.
more vitamin K.
K, yeah.
Okay, so whatever the vitamin K you will get from your food, right? Is it enough to hinder the effect of warfarin?
no, ma'am.
No,
Now
ma'am.
read the full sentence. Amandeep, read the sentence. Did they said avoid excessive eating or they said avoid eating?
Avoid eating.
They do not take the green leafy vegetable. Is it good? Right? You have to be very careful. Avoid excessive eating is good. Avoid eating green leafy vegetable is also good. It is a good source of iron as well. Right? We will see. Maybe it's wrong. I should avoid caffeine while taking warfarin. How about this one?
True.
It's true.
Right? Do you think caffeine will be related to something related to warfarin? Caffeine, any idea, anybody? Any guesses?
It's a CNS stimulant.
So caffeine, most of the time when you are eating the smoking, caffeine, alcohol, these three things do interact with major, like especially with the blood thinners. Okay, so it can be interactive. So maybe we are 50-50 about this one. I should avoid. Avoid means I will not do that. Is it something wrong? We are not sure. I will tell you like in my next upcoming classes, like on Wednesday, but I will teach you here. But 3 and 4, let's do that. I will avoid taking aspirin. Is it right or wrong?
Right.
Right. Aspirin, blood thinner,
And
warfarin, blood thinner.
warfarin is blood.
I should not take nutritional supplement without talking to my healthcare provider first. Is it
True.
something wrong that
True,
you're talking?
true.
Right? Now, which one is safe? Avoid eating the green leafy vegetable or avoid caffeine?
First,
First one.
And avoid caffeine, how about caffeine? This one is, so green leafy is absolutely you are not doing. You may get, for me, I'm thinking that it might get low iron, and we are never doing, we are teaching them to avoid excessive. That is what we have learned, not totally cut off the green leafy vegetable, right? Avoid eating the caffeine should be good. All right, let us see. Like, I will go from here because of the word which is played by NCLEX, avoid eating rather than avoid excessive eating. See, that was the answer. Okay, let us read about two. Caffeine and alcohol may interfere with the effectiveness of warfarin and should be avoided when taking the warfarin. Caffeine, alcohol, smoking, these three things, they might will affect most of the not with the Tylenol, not with those one, but anything, digoxin, warfarin, heparin, just don't take the caffeine. Okay, that is simple and steady tip. Okay, read this question and let's see that how we will proceed with this one. I think we just did this last week. Students who are having the exam in next month, or who are planning to write the NCLEX exam, please just let me know. I will give you. Okay, good. Okay. Solange, you choose 3. Why?
So sorry, I'm beside noise, but I'll go off. So my reason for choosing three, not that I know the answer exactly, but I start with the elimination procedure part of it. I don't know the right answer, but I choose, like, if they are mentioning that a sore throat and a bright red pruritic rash on the chest, like, when they talk of skin allergy, they didn't mention that this client has taken any medication for me, so I had to eliminate it. Then, when they came to complete blood count, like, what are we ruling for? I already know if they're talking of pruritic, it could be infection, but then I just kept that aside. I'm like, okay, I don't feel that that is 100% for me. It's a probability. Then I move to the rapid streptococci antigen test. I feel like, yeah, that will rule in case of any infection. Yeah, bacterial infection. That will be more precise. But complete blood test, I eliminate, because here I had to eliminate it because complete blood test can rule out a lot of, not
Yes.
only bacterial infection, a lot of other then skin biopsy. I don't feel like just a rash can, it's just like I bring in common sense. Not that I actually know the answer, but
No,
I
that
just
is
try
what we are
to look
learning.
for it.
Excellent. So I just absolutely love the way she did the question, that allergy is not happening. Skin biopsy, maybe if there is other thing, like if there is a risk of cancer, we will do the biopsy. What did they say? A sore throat. And now she's having rashes like a sunburn, red rashes. Okay. I loved the way she did, because she said, if I will do CBC will, for example, if WBC is high, it will just tell there is infection. They will not tell you why is infection, what exactly the infection is happening. If there is a platelet is high, we don't know specific that this is the diagnosis. With rapid streptococcal antigen, I know that this is a diagnostic procedure. We will find out the cause. this is what she did the question, because from CBC we will not be very, very sure that what is happening, which is absolutely amazing. How I am seeing the question, sore throat and the rashes. Did Alveen taught you and showed you some kind of picture? Remember, we have to apply the knowledge here. That is why when I'm teaching, I am giving you like a lot of pictures. I want to show you the sign and symptoms. Okay, anyone remembers that sore throat and fever, like the rashes? What was that?
It-
Yes?
Does it look like, ma'am, red man syndrome?
No, Amanpreet, red
It's a
meat is
So
strawberry
like
very
rash.
important. I will teach you.
Kawasaki disease?
Kawasaki disease, strawberry rash.
Okay, Kawasaki disease. What is a different definition of Kawasaki disease? It is the inflammation of
Vessels, small.
vessels, and it is autoimmune. Is it related to sore throat?
No.
No.
Okay, it is not. Okay, we are seeing that. How many of you guys remember? Okay, now, Aman, did I taught you about Redman syndrome yet?
I learned in a question, so that's why.
Yes, you learned in the question which had vancomycin in it. Okay, so vancomycin is related to Redman syndrome, very important topic. I will teach you in my grand miscellaneous topic. I am trying to ask you guys, and my question is, do you guys remember in pediatric that I showed you one of the picture that it is all red, and this is a sore throat, related to sore throat. Which disease was that? Anyone? Do you remember scarlet fever? Sore throat. I told you guys rheumatic disease when I was like, whenever there is a sore throat, first of all, we have to treat it with antibiotic. Sometimes they are having the sore throat, they will become very red, rashes over the skin. I showed you the picture, the scarlet. We call it a scarlet fever because of the redness, because of the rashes due to that bacteria, scarlet fever. It is nothing but the sore throat plus rashes. If you will not treat it, sore throat plus joint pain, sore throat and cardiac murmur, sore throat and those kind of things, right? That is rheumatic fever. You should remember this one. I told you guys that please don't miss my pediatric lectures. I wanted to show you the picture. So scarlet fever. I hope you guys remember. Let me see that if they have explained it. Yes, it is a scarlet fever. Let me see if they have, yeah, red rashes. Look at that. I showed you the picture where it was full, like the chest was all red. Okay, this is the one. Okay, so I understood why CBC is not the answer. The way she did it was amazing. Okay, the next client, the next question. The nurse is caring for a client who has acute stress disorder following the traumatic event. Okay, which of the following action should the nurse take? Alveen didn't taught us, Sarab didn't taught us yet. Maybe Sarab have taught in mental health, right? So let us see. If she didn't, like, let us see that how we can apply the knowledge, how we can learn the guess strategy. Okay. Try to do this question. I will give you a couple of minutes.
Ma'am, can you zoom the screen little more bigger?
How about everybody else? Are you seeing it from your phone?
No,
Yes, I am.
laptop. I'm seeing.
Shama, like, how about everybody else? It should be good. Is it low? It is very small,
No.
No, ma'am. No small.
right? So Shama, maybe you have to see the your laptop configurations. You can zoom it.
Okay, ma'am.
I like
Thank you.
yes. Okay. Okay, let us see. The nurse is caring for a client who has acute stress disorder. Now I'm saying, because I'm not teaching the mental health, but still, acute stress disorder, like she's having some anxiety right now due after the traumatic event. Which of the following actions should the nurse take? What is good? I should true and false. I will choose what is true and good for this client. Ask the client directly about the thoughts of self harm. She's under stress. Yes, I need to make sure that she's not, thinking about the self harm. Yes, I will do that. Is it any false? Anybody who didn't pick up the one, is there? I will check that. What is a false statement? That I don't care if she's harming herself. No, that is false, right? One is correct. Discuss the impact of traumatic event on the client's relationship. Should I do that or not? What do you guys think?
No,
No, ma'am.
because it will create more stressful situation for her. Like
Can
For
if
the
elevate
you
his
elevate
anxiety.
the anxiety and
Yes. Instruct the client to focus on recovery and to not dwell on traumatic event.
no,
That we are telling that please focus on your recovery, and she's having the sign and symptom.
No,
this is
ma'am.
kind of ignorance.
Okay. I just wanted to ask, okay, so assess the client for use of alcohol and recreation substance as a coping
Yes,
mechanism.
yes,
Should we do that or not do that?
Yes,
Yes, we
yes,
can check that.
Can do, ma'am.
Is it true?
yeah.
True.
True, ma'am.
Is
yes.
it true? It is true. Remind the client that experience. I didn't get chance to about the tour. Let me discuss again. Remind the client that experiencing difficult symptoms after the traumatic event is expected.
Mm,
Yes.
Now,
yes,
what remind that please you have to
no,
think yourself that I am telling them that yes, you are feeling stress right now, but you are not alone. It is expected, right? Don't distress yourself. Is it
false
good?
insurance. This is a false, like, so it will create
So
the more
what is the
stress.
definition of false insurance?
Mm,
Is it a false insurance? For example, what is example of what is the definition of false insurance for
like
you?
if, ma'am, if like, yeah, this is expected. It was happened with you. So if the result will become like this is expected. Like
So
this.
it is not
Not,
expected. So let us say, so it is true or false. Remind the client that whatever she's experienced is expected. Is it true? What is a
This is
false
true.
statement?
It's
This
true.
It
experience,
is
whatever
true.
you are feeling, is not expected. Do tell me, true or false? That is what I'm trying to teach you guys here. That whenever you do SATA question, it is not assumption. We have to learn true or false. Is it expected thing or not expected thing? Narinder,
so this is expected thing, but
that is what
yeah.
that
So,
is
but we
right.
don't need to remind the client these things because it will create more stressful situation for with
Okay, so
client.
Narinder, for example, you have gone through any stress and you are crying.
Mhm.
And I'm telling you, it is okay to cry, right? It is absolutely fine. Please cry more. It is nothing wrong that you are crying. So you will cry like it is reminding you what is happening, what has happened to you. No, we are
No, ma'am,
encouraging. What is the
ma'am,
meaning of
ma'am, if I will say that, like, okay, so I can understand your situation. So this is a difficult time for you, like that.
So that is what my
Nurse
dear.
didn't make, yeah, nurse did not made any statement of her own. She did not use her personal experience. She is just using the generalized statement that after a traumatic event, there are difficult symptoms that are expected. So even if you are expecting, it is expected as well.
It is expected
Yeah.
that she is not abnormal, that she is not going through totally different thing. So the students who are thinking that, that I really want to see the word, NCLEX doesn't go with the words that you really, because you have learned, there is two lines in the like whenever you do psychiatry, explore the feelings, and you are expected. I really want the nurses and NCLEX to use the word explore the feelings, right? And I want what Narinder has said, that I understand what are you feeling, this and that, to be more empathetic. NCLEX doesn't work like that.
Okay.
Okay, because they are not testing you the basic knowledge. This is a real life situation.
Ma'am,
True,
I did
us,
some
it's not.
questions. So there is a mention like I can understand your situation. So tell me more about your concern about the disease, like how you feel about the disease.
So
So
that is explaining, yeah,
more,
that is
yeah,
that question. You didn't
yeah,
expect that tell me more about disease thing.
yeah,
That is asking them.
yeah.
Now
Okay.
telling them, it is not false reassurance. Are you doing it false? For example, a cancer patient. Let me, maybe everybody else, maybe any of you guys are thinking that maybe it's a false insurance. You should know what is the meaning of false assurance. For example, there is a cancer patient. He is saying, am I like getting better, or will I survive for 10 years? And you are saying, yes, you will.
That's the false
That is
assurance.
false statement you are giving to it. If you are not sure, you are not. For example, a cardiac patient, you are saying that this is a jaw, you are having the pain on the left side of the chest, and it is expected in the cardiac. It is not false insurance. You are telling him the facts. All right, it will not distress more. How it is distressed? For example, if you are going through any, like you are just thinking that I am something bad is happening. I am crying a lot. Am I getting upset? I'm getting, somebody is judging me. How the nurse will think I'm crying a lot, and if the nurse is going and saying it is okay. You are crying. That is expected. Everybody will do that in situation. Will you cry more, or you are, it is actually helping the patient to understand that whatever is happening to me, I am not the one, something is not going wrong with me. Maybe she will be more stressful, that okay, oh my god, something different is happening to me. You are actually helping him. Traumatic event is expected, that absolutely fine. You are crying, that is okay. You are supporting her. Okay, discuss the impact of traumatic event on the client. Now, you didn't choose this one. Now you are saying explore. You love the word explore the feeling. Only that is what you are looking for, that one. Now read the option number 2. Do you think you are exploring her feeling or not?
Yes.
Right?
Yes.
Now,
Yes.
that is a critical thinking. Critical thinking means that you really want to apply the knowledge. Explore the feeling. Is that enough? Now they are exploring the feeling, that how it is affecting your relationship. Tell me more about it. Understood? Now
Yes, ma'am.
let us see that what is the correct answer. See, 1, 2, 4, 5. If you didn't, let us see that what they said. Explaining the feelings or symptoms occurring after the traumatic event are expected because they can help to alleviate the anxiety. The patient is anxious. If we are telling it is okay to cry, you are not alone. Everybody will cry in that situation. That is helping him. That is not happening. And this one, my dear students, please make sure that NCLEX, please, NCLEX is not using those normal that everybody is learning and crammed about it. Explore the feeling. They will not do that. This is exploring. You have to use the thinking. Use your brain. Like, yes, it is also explore the feeling. Understood, everyone?
Yes, ma'am.
I hope you will learn something on that.
Yes.
My next question is this one. A nurse has provided teaching about home care to parent of 10-year-old with cystic fibrosis. Which of the following statement by the parent indicate teaching has been effective? True and false statement. And so I want to request Narinder. I just want to request let the other people participate. Please respect that. I don't want that you are participating in each and every question. Let the other people do that.
Sure, ma'am.
Okay?
No problem.
So please write your
No, ma'am. Actually, I was confused. I was
no,
choose
ask me the question.
questions.
Yeah.
I got the right three of like 1, 4, and 5. It
No,
was
no,
right.
I will get
But
back to you. If each of
yeah.
you, if you have the question, each question option, right? I will
Sure,
not to
ma'am.
explain you.
Thank
Let
you.
me ask other
Sure,
people,
ma'am. Sure,
and
sure.
then I will give you the way that okay, ma'am, why two is not correct. I'm thinking that,
Sure, ma'am.
and
Yeah,
you're
sure.
most welcome. Okay.
Sure. Okay, ma'am.
Okay. Okay, guys, do this one.
Ma'am, question is not in the center. It's not showing properly.
Namlet. How about everybody else?
It's fine. She might have zoomed
It's
in
fine.
and then
It's
she might
okay.
need to zoom
Yeah,
out
you
further.
might have to, do scroll your screen, Namlin. Okay, so if you want to, join the class from your phone, that is most welcome too. I will see if I can do that. This one, is it better little bit? Mm-hmm. Students, I want you to give me the answer privately in not as such, because students who are reading the options, they get confused. Okay, I will also write 1, 2, 3 or whatever if the first student have chosen. So I want everyone to give me the answer in a private. Okay. Okay. Okay, let us Suman Yogi. Suman Yogi, can you unmute yourself? Suman. Can you hear me?
Yes, ma'am.
Yes, very good. Suman, what do you think is the correct answer? Let us do.
I just think the correct answer is 1, 2, and 4.
Okay, you have to, that is not we will do. We are learning something that how you will end up in 1, 2, and 4 or something, right? Why did you choose 1? Why didn't you choose 3 and 5? Explain me that.
I didn't choose 3 because it says like that I will increase my child's salt. Food intake is okay, but because of the salt, I didn't choose this one.
Because of salt. Okay.
Yeah.
Mm-hmm.
And in question number 5, I didn't choose it because it is like we can't restrict the children that they can play for 15 minutes or 10 minutes or 3 minutes or 2 minutes or 1 hour. We can't limit on their playing activities like that. So
Okay.
I
Okay.
just
So now
eliminate
why you choose
this.
1?
I choose 1 because if the respiratory symptoms worsen, physiotherapy always works.
Okay, so now what is
Yeah.
cystic fibrosis? Now we have to learn that how to do this question. Okay, everyone. So what is as soon as you see cystic fibrosis, did you learn about cystic fibrosis? Yes. What is cystic fibrosis? Fluids are very thick,
Thick in
very
different
Thick
size.
secretions.
right? Is it normally, is it expected? Yes. Is it all the time? Yes. Chest physiotherapy is administered only
Mhm.
if the respiratory
Wrong.
system works. Otherwise, I will
No.
not give the chest physiotherapy.
No.
No,
Wrong.
no,
Wrong.
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 It's wrong.
No.
So, student who choose one, ask yourself, what is wrong? Why I choose one? Did I missed only?
Yeah, ma'am.
Yeah, if you say only, that's a wrong statement.
They said chest physiotherapy, it's administered. It is very important for them to breathe. What did we learn in cystic fibrosis? Raman Kaur. When to, how often we should do the chest physiotherapy? And when? What is a nursing education? We have learned that we have to encourage the parents to do the chest feed before the meal, right? Or 2-3 hours after the meal. Chest physiotherapy is very important. Their risk of having the pneumonia and everything, they can't breathe. We have to make sure it is not that cystic fibrosis, they are always good, the thick and sticky, every single time chest physiotherapy, but very important. Okay. I will give my child pancreatic enzyme with meals and snack.
True.
True.
Yes,
No,
true.
ma'am.
Yes.
Yes.
True.
All the time. It is lifelong. This is also lifelong, my dear students. Yes, too. I will increase my child's salt and fluid intake when playing outside during the hot weather.
Yes.
Why and why not? Okay, tell me about yes. The student who are saying yes.
Because when they're playing
Because
outside
when
in the hot weather,
Hmm.
the sodium.
with the perspiration, the sodium, and
They are playing outside. Is it written?
playing
It
Yes.
says
outside.
they are playing outside. So don't assume.
Yeah, it
Don't, where
says
it is
playing
written?
outside.
Oh, playing
It's
outside. Yes,
there.
it is written. They
Playing
are
Yeah,
outside,
moving.
yeah.
Okay, that is good. During the
yeah,
hot weather, good.
yeah.
They will lose. Anybody
Sodium.
else who didn't choose
Perspiration.
3? Who is not choosing 3? Okay,
Mm.
Simran, you didn't choose 3. Why?
Didi, I thought like it's not a applicable option.
Okay.
Yeah, that's why I didn't choose it because they're not gonna play because they have cystic fibrosis. They do not have that much capacity to play outside.
But they said, we know we
They
are
are
not
playing
assuming. I
outside.
assumed when playing outside during the hot weather. We are not assuming. They told they are playing.
Yeah, yeah, I didn't choose. I don't know why. But
Okay. Okay. How about Shama has
No.
chosen Mary. Why didn't you choose 3? Let us see. Now nobody will. 3.
The
What is
disease.
wrong? Because this one, the SATA question, they work on true or false. It is
True.
not that they are nothing. Either they are true or false.
Why I didn't choose 3? From the sentence, I will increase my child's salt and fluid in the word increase my child's salt and has no relationship to playing outside during the hot weather.
Okay. Now, let us discuss what is cystic fibrosis. What are the signs and symptoms? Excessive, thick and sticky, exocrine fluids. Okay. How about salt? How they are losing the salt? Let
With
me
sweat.
why?
with sweat.
Perspiration. Yes.
What is a sign and symptoms? Sweating, will,
Salt.
salt will,
Lose.
Release.
Yeah.
That is a sign and symptom. In fact, what is the diagnostic thing? We are checking their sweat. They're losing salt. They are risk of having fluid electrolyte imbalance. Why is
Yes.
Imbalance.
electrolyte imbalance? Because they're removing the salt from their body through sweat. Did we apply the knowledge here? We knew. So now many students, let me give you an example, that many students, when they're scoring less, right, they will blame, oh, I forgot the cystic fibrosis. That is why my scores are less. That is what I was talking to you yesterday. It is not that you forgot the cystic fibrosis. It is because you didn't applied the knowledge. Okay. The only thing is mind thick, maybe secretions in the respiratory system, and you forgot to apply the knowledge to the rest of the body organ. You don't forget that. Okay. Our child will need diet high in calorie, protein, and fat. Does he need?
Yes, ma'am.
Yes,
And
ma'am.
why?
For, for energy.
For the
Mm.
energy,
Is there low energy? That is why calorie, protein, fat?
Because they're producing lots of mucus and I mean that
Okay, so high diet. Diet is related to GI. What is happening in GI system?
because they have all the secretion is thick and cannot absorb properly.
They cannot absorb. So that is why what diet? High in calorie, protein,
High
fat.
calorie protein diet.
We will limit our child's participant and support to 15 minutes per day.
False.
False.
You can't decide 15 minutes, 20 minutes. As per toleration, we will do that. Okay. So what is the answer I should choose? Pancreatic enzymes. I will increase my child's salt intake, and our
Number
child will
4.
need the high protein diet, not this one and only. Do you got it?
Yes, ma'am.
Yes, ma'am.
Okay. Next is
ma'am.
yes, yes.
Uh, can we see the rationale of 3? Which wait. Yes. What is the
Sweat gland abnormality. I explained it to you, Shama. Sweat gland. Do you know, no? Like when they are sweating, they are losing the salt.
Yes.
That is what I explained. That is the same thing.
Okay, ma'am.
Okay, so the next is Mary. This is your question.
The office nurse the office nurse receives
Mary,
for
did I ask you the question previously?
no.
Okay, I think
You asked me a question concerning the cystic fibrosis.
did I?
Yeah, you
Okay.
did.
Okay, then Sharon. Sharon, this is your question.
The office nurse received 4 telephone message. Which client should the nurse call back first? Option first, 32 years old woman with temperature of 100.4 Fahrenheit who reports feeling achy following a flu shot yesterday. 50 years old man who reports right shoulder pain and difficulty raising in the arm above the head after playing baseball 2 days ago. 68 years old woman with left sided jaw pain, dizziness, and nausea who thinks it is an infection related to routine teeth cleaning yesterday. 72-year-old woman with urge incontinence who started taking solifin 2 days ago and reports constipation and very dry mouth. Ma'am, for the first option, it is normal because he took an flu shot yesterday. He can feel like ache, body ache. And for the second option, who reports right shoulder pain? For the second option, he's facing right shoulder pain. Maybe after playing the baseball, he he got any kind of muscle spasm or muscle
Mm-hmm.
so I would like to eliminate option second for now. For the option third, yes, because he has left side jaw pain, dizziness, nausea. Sometimes, like it is written, routine teeth cleaning yesterday. Sometimes the infection, it can leads to, CNS. It can goes to. um, for option fourth. He has urge of incontinence because he is taking Solifensin. Ma'am, I don't know this medication, but I think the correct option is number third.
Okay. Anyone else have different answer or different explanation for 3 want to participate? That ma'am, I think 2 is the answer, 4 is the answer. Anyone else?
I think three is the answer, but the reason could be the MI
Very good.
because the left sided jaw pain.
Very good. And why so?
Uh, because usually with the chest pain, it happens like it radiates to the jaw or the shoulder. So that's the number one sign. Like it could be MI, but she thinks it's a routine teeth cleaning.
Okay. Anyone
Yeah.
else wanted to say why it is MI?
Yeah.
Left jaw pain, that is fine. And why dizziness and nausea?
Yes,
Uh,
because in women's
It is
MI
women.
signs are different.
Okay, got it. So women is the reason that because they represent different. So it was the question of MI, but look how the NCLEX tricked you that he is having teeth cleaning yesterday and many student jaw pain. That is expected. No, okay, we shouldn't take it like no. It is a serious thing. Okay, very good. The next question is for Lovedeep.
The nurse is providing discharge teaching for a client who has low health literacy level. Which of the following actions should the nurse take? Select all that apply. First, speak loudly to the client. Repeat important information. Utilize the teach back method. Provide as much detail as possible. Use visual aids while presenting information. Ma'am, first speak loudly to the client. It's wrong. And then repeat the important information. Yes, we can repeat the important information to the client. Uh, Utilize the teach back method. Yes, we can apply. Provide as much detail as possible. Use visual aids while presenting information. Yes, ma'am. 5.
4, I didn't
4.
get it.
Yes, provide as yes, ma'am.
Okay.
Each and everything we can provide to the patient.
Okay. Now, everybody else, please, the stage is your. If you want that, ma'am, 1 is correct or out of 2, 3, 4, 5, I don't think that this is the correct answer. Anyone want to mention? I didn't think so. 4. Okay. Veerpal also. So, Veerpal, first of all, let me ask you why 4 you didn't choose 4. Veerpal.
Oh, ma'am, sorry. I choose four because I am just busy in cooking. So I just click the four. Need to click the four, but write the three.
Okay.
After that, I
All right.
repeat the.
Narendra, why
Yeah.
you think that four is not correct?
Ma'am, here is a mention like provide as much detail as possible. So there is a mention in the question. So client, the level is literacy level is a low. So we need to provide the information according the capable level, like according to the client capable level. So if say like client provide as much as possible, maybe she will provide more information like that. So maybe I don't think so. This is the right option.
Dilpreet,
So
what do you think?
Ma'am, same. I was thinking same as Narinder because if we are giving so much information to the client, he might forget the important one.
Yes, I think same because that is fourth. Are you getting me? Provide as much detail as possible. His literacy level is too low, right? If you're giving too much detailed information, there is chance he will forget it. If the child patient, like there is a client whose literacy level is low, and give him a concise, clear information, small information which he will never forget. Okay. Yes, very good. So I don't think so. Four should be the correct answer as well. Let me see that. I will go with the student whom I asked. See, look at that, four. Okay.
ma'am,
Very good.
I have question. If
Yes.
there is a mention like a simple sentence, like one time use a simple sentence, so it will be the option.
No, please. You have to,
Okay.
like, it is not the simple constant
Yeah, yeah.
sentence,
Okay.
complex state. And
Mhm.
another thing, let me tell you, Narendra, you are a really good, intelligent students. But what I'm noticing, right? Excuse me, because I do notice the things and I really want my students to improve. Because I think when you are watching and following a lot of, other platforms,
Mhm.
like I might be wrong, but I think that you are following a lot of things. Don't use only, don't use this thing, use the things which are very simple. It is not like that.
Okay, ma'am. Thank
Okay, so please don't use those techniques, which is like you have to use your brain. You have to rely on the knowledge rather than the guessing system. Okay,
you.
Narinder,
Yes, ma'am.
that is
Yes,
what I'm
ma'am.
trying to say. You are intelligent. You like,
Ma'am, I
you.
was confused because I did some boot camp questions, so sometime I
No, no, no. It
confused
is
with
not.
all
Boot
this.
camp is also good. That is not
Mm.
that boot camp is wrong and this one is high.
Mm.
No, no, no. Okay, so
Depends on the condition, questions and
every single
everything.
question is same. Like even if you will send me the, like ask me the question, if you are going through and that, ma'am, why this is option, I can explain it to you. But don't assume that I will, clear my NCLEX exam because I think they will use, there is a hint in the NCLEX exam. Don't go with that.
Okay,
It
ma'am.
is a
Thank you.
knowledge exam. Give the answer based on the knowledge, not the language or the grammar or the only or always things. No, don't do that. Okay, so the next question is name lane. Oh, this one is. Let us do this thing together. Okay, this is a case study. The nurse is contacting a client at 28-week gestation to review the lab result and schedule follow prenatal visit. Lab result 5,000 to 15,000 lab result is this one. And now 12-week was 8,900 and now she's 16,000. Hemoglobin, pregnant lady, she is 10.8. Hematocrit 32%, right? They already gave you the normal thing. Chlamydia test is negative. HA1C is 5.1 at 12 weeks. They didn't do it here. Glucose test was a 175. 3 hour, and this one, the fasting was 150. 1 hour was 205, 162 mgdl, and 135. Okay. So these are the tests. Let me get back to you guys in my normal, this one. Okay, this one. Now you can see all the things are together. Let me also, can I do this one? No. Okay, so which lab result from 28 week require priority? So everything is abnormal, you might feel see. Now you have to think that what is abnormal priority? Should I go for 3-hour oral glucose test, chlamydia test, hemoglobin or WBC? Which one is priority and why?
Um,
Can you scroll
Glucose
down a little
tolerance
bit?
test
Okay,
first.
here you go. Everyone, just give me the answer. And why?
Ma'am, first.
Okay. Show me one. Okay, students. So
Because
that is why I just don't like when you are talking, everyone. Right? You have to give me the answer in the chat box. And who else of the is anyone is going through any other question, like any other option other than one, high sugar? Okay. How about WBC? Why didn't you choose the WBC? Let me ask the question to Amandeep Kaur. Why didn't you choose WBC? It was high too. I just want to make sure that you are not just saying that somebody is saying one, I will choose one. I will also choose one. Amandeep Kaur. Manveen, why WBC count is not correct? Why you choose one over WBC?
Ma'am, maybe there is a risk of infection, but maybe priority is 3 hour sugar because of gestational diabetes. That's why.
Okay. Becky, why hemoglobin, the low she's having 10.8, right? Why you didn't choose hemoglobin over 1?
I didn't choose hemoglobin because that like when she's pregnant and that when you're pregnant, like sometimes your hemoglobin will be low.
Okay.
That was my rationale for that. I chose like the first one because I figured like when you might have like a gestational diabetes, and so it's a high risk for the baby too as well because the
So because
hypoglycemic
it
can
is
do that.
28
So I
week
had to
and we are doing, yes. So this one, it is so high and it has many complications ahead. Infection, we can treat it. It is a little bit of high because 15,000 is normal. 10.8, we are not going to do the blood, transfusion, etc. for this one. And chlamydia test is already negative. So definitely I will also choose 3 hours. Good. The next. So this is the same test. Did they change the difference? No. The client has been diagnosed with the gestational diabetic mellitus. And then with the good part with the this case study, you know that my previous answer was correct. Which of the potential complication could occur as a result of this diagnosis? So students, please, everyone, especially Narinder, if you can please turn on, give me the personal answer, not in the chat box, not to everyone. So what I'm trying to say is that whenever you are doing here, message everyone, you have to, oh, where did it go?
ma'am, then where I need to send the
Yeah, so if you
answer?
will choose in the chat box. Let me show you. This is a blue box, okay? And you will see Sure Success Nursing. So how everybody is doing it, sending it to me, okay?
But it's not showing on my own one. I've been trying to.
Yeah, it's because
Yes,
I can't see.
That's on my chat.
Ma'am, I don't know where I need to send.
Okay, so whenever you will, you have to just give me, let me see.
In the
Okay, so
group or in
this
the
is the box.
WhatsApp?
And no, not on WhatsApp. Can you see the chat box here? You are sending me the answers over here. So go to the chat box, right? And this will be the screen where you are writing me the answer. You will just click here and they will see the name. So for example, you will see Sure Success Nursing Hub. For example, I will choose Arzu here. And whatever I will be typing anything, it will go only to Arzu, not to anyone else. Right? So choose Sure Success Nursing. It will give me the personal message, not to everyone else. So
It
Ranjit
doesn't
is
it
doing,
doesn't
Debbie
give
is
you that
doing.
option though.
I did not
It
get
doesn't give you the option of show success. It's actually blocked. So it only
Yes,
gives you
ma'am,
one
there is
option.
no
Ma'am, I
option.
It's
can't do
blocked for
that.
show success. I know
Oh,
what
okay.
you mean, where you can click, where you can have a drop down. You
Yes,
can send
Guys,
it to even
Gift,
one of
how
the
are you
students, but
doing?
there
this
is
one,
an option. There is an
Yeah.
option. If you go
Hi.
to chat and there is a Blitz Day, under that there is an option. You can choose from who you want to text. It says right on top, sure success.
So here
Uh,
is the only
I can
option who
also
can
help.
see your
Yeah.
message.
You
who
can
can see
you
your
can go to
message? Choose
chat.
your success.
You can go to chat, and on your right side, you will see a little arrow which is downward. You can click on the arrow, and then you will show more options: new chat, main chat, and then show success. Because I have chose that one.
Yeah, that one. Yeah.
Namlin,
Thank you, Amrit.
yes, that is good. She's doing that. Very good. Okay, not at Amrita, not just choosing that one. It is still visible to other people. Okay.
Ma'am, I have only option new chat and main chat. No sure success.
Yeah, you have to
Yeah.
use the new chat, and then
New
there will be
chat.
a search option, and then you search
Okay.
your success, and then
Okay.
you click OK.
Thank you.
I don't know.
Thank you so much. Thank you so much for helping me. Okay, students. So about this one, let us do all together. Okay, and let me see what is the correct answer for you guys.
2, 3, 5.
Mhm. Okay.
Ma'am, are you able to see?
Narinder, not Narinder. Okay.
Ma'am, I just sent it.
You sent it in the main group, not to me.
Again?
Yes. Okay. Namlin, I was asking you the question. Let us see. So client has been diagnosed with gestational diabetes, and what is the correct answer? So is he risk of having fetal heart defects? Namlin.
No, ma'am, because fetal heart defect is related to folic acid
Very good.
deficiency.
Macrosomia.
Yeah, the large size baby
Large
is
size of
related.
baby. Fetal shoulder dystocia.
Yeah, this is also related to heart, large size baby
Large
during
size
delivery.
baby. Yes, the large size baby is happening here. Placenta previa.
This is not related to.
Is it
This
happening because of diabetes?
no.
No.
Placenta previa is something.
Preeclampsia or hypertension. There are
Yeah,
other things which can
hypertension
cause.
related. Preeclampsia
Polyhydramnios.
is related to hypertension and polyhydramnios also related to diabetes.
Okay. How about 5? Polyhydramniosis.
Hmm.
What is
Polyhyd-
poly? That is how, let us read. Manveen.
excessive
Okay.
amniotic fluid.
Yeah. So Manveen, what is poly? Hydramniosis.
Ma'am, excessive poly means excessive hydro means like
Fluid of
amniotic fluid.
amniotic fluid.
Yes, ma'am.
Do you think it is related to diabetes? Can it happen in diabetic patients?
Maybe no, ma'am. I'm not confirmed, but
Okay.
yeah.
Okay. Namlin, what do you think?
I think this is happened because the baby is more big, though.
Baby is big. Okay. Okay,
So
how about
would also
preeclampsia?
required more.
Yes, how about preeclampsia? Diabetic is the risk of preeclampsia, yes or no?
Preeclampsia related to blood pressure, increase high blood pressure. So not related to diabetes.
Okay, Manveen, you choose 6. Why?
Ma'am, I'm just still confused in fifth or sixth option, so I chose sixth.
You can choose as many as possible. It is not that you have to choose between 5 and 6.
No, ma'am. I have a confirm about the two and three, but I am confused in fifth or sixth.
Okay,
So
rather you choose not to choose. If you're confused, don't choose it. Good.
yes,
Okay,
ma'am. So that's
Lavdeep, why if 6th is the answer?
Ma'am, I think diabetic patients get might preeclampsia too.
Mm-hmm. Raman Kaur,
Yes, ma'am.
is it a risk factor of preeclampsia?
Ma'am, I think gestational diabetes mellitus, there is a complication that patient will get gestational hypertension. So that's why I chose preeclampsia.
I don't teach you. Yes, it is a risk factor of preeclampsia for me too. But let's get back. Now, next, let's ask Manveen. So this is the same question, okay?
yes, ma'am.
Physical, they have said BP is 125/75, then it is 120/80, weight 175, and now it is 177. Fetal heart rate 155, 145 now. Fundal height 30, and now it is 31 centimeter. Contraction 28 week, it was occasional, and now every 2 to 3 days. Urine 28-week positive glucose, and even now it is positive glucose. Nurse's note: the client returned to the clinic for the follow-up appointment due to poorly controlled blood glucose. Okay, home glucose level are consistently above the target. The client food diary is reviewed. Carbohydrate intake at the breakfast and dinner is higher than recommended. The client reports occasional urinary frequency, but otherwise no dysuria. Okay.
Yes, ma'am.
Then complete the following sentence by choosing from the list and drag the word from the choice below. Okay. So how to do that? The nurse should be most concerned about what? Glucose urea, contractions, BP, or glucose level?
Ma'am, glucose level
Okay, why?
because he is not able to control the sugar, so that's why.
Okay, and anybody else have different answer? Anyone else has different answer? Okay, then anticipate the client's need for what? What do you think?
Insulin? Oh, sorry, I didn't mean to answer. Insulin.
Okay, let us see. Blood glucose, most concerned about the blood glucose level, which I agree as well. The nurse's note, is it different? The same thing. Physical is the same. The nurse is preparing client education about the diagnosis and prescribe. See, this one was correct. Which 3 instruction? Now please pay attention to 3. We have to choose 3. Should the nurse include in teaching? Avoid including carbohydrates in your diet. Yes or no?
False.
No.
False, ma'am. No.
Should he avoid?
Yes.
No.
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 Draw NPH into the syringe first and then insulin?
No.
No, ma'am.
No.
No.
RN, it's RN.
RN. Eat the meal 60 minutes after taking your insulin dose?
No.
No,
No.
ma'am.
No. insulin, you have to inject insulin into subcutaneous tissue in your abdomen.
True.
True.
Yes.
Monitor for symptoms such as headache, trembling, hunger, sweating.
Yes.
Yes, ma'am.
Yes.
True, ma'am.
Perform fetal kick count daily to monitor the well-being of the fetus.
True.
Yes.
True.
True,
True.
ma'am.
True.
Yes.
And why?
To see the baby is healthy, not
Glucose.
sleeping because of the diabetes.
Diabetes.
Because of the diabetes.
Diabetes.
Yeah.
Because of, there is a risk of hypoglycemia in the children. Okay. The next is the same question. Did they change the note? Yeah, see, look at that. Now she's 38 weeks. Client report having a light breakfast. Last dose of insulin was NPH at the bedtime. The blood glucose is 155 right at 7 a.m. Okay. Insulin infusion initiated. Cervix is 3 centimeter, 80% effaced, -3 fetal station, amniotic membrane intact, cephalic presentation. Capillary blood glucose at 9 a.m. is 135. Surface is 5 centimeter, the same 80% effaced and -2 fetal station. Amniotic membrane is still intact. Cephalic presentation. Contraction is 3 to 4 in 10 minutes, 50 to 60 seconds. Moderate, soft, resting tone on palpation. Fetal heart rate. Baseline is 150 per beats per minute. Moderate variability. Positive acceleration. No decelerations yet. 10:45, a new onset of shakiness and sweating. Previous BG measurement at 10 a.m. was 122. Right? Contraction is 4 in 10 minutes, 60 to 90 seconds. Moderate, soft resting tone on palpation. Fetal heart rate is 155. Moderate variability, no acceleration, occasional early deceleration. The nurse has reviewed the information of the nurse's note. Client Gravida 3 para 2 at 38-week gestation is admitted at 7 a.m. for induction of labor. Now, which action is the priority? What do you think? Should you give dextrose 5%?
No, first we check the blood glucose level.
First, you want to check the blood glucose level before you give. Good. Discontinue the insulin infusion. That is first thing you do.
No.
No.
Obtain the blood glucose level.
Yes.
Yes.
ma'am.
Yes. Maybe hypoglycemia.
Perform cervical examination first.
No. No.
The first thing is always assessment. Okay, good. Okay, this is the same physical nurse's note. Did they change it? No. Progress note. This is a doctor's note. 30-year-old Gravida 3 para 2 at 38. I think this is the same thing. Click to highlight below the 3 findings that indicate a complications. Okay. Now I will see which complication. 30-year-old Gravida 2 para 2 at 38 week, history of regular prenatal care, gestational diabetic mellitus, come for induction of labor. Secondary to poorly controlled blood glucose, estimated fetal weight is 8 pounds. Client is taking insulin. I didn't see the yellow part here. Here, client received insulin infusion for glucose control, IV oxytocin, 6 for 6 hours. The fetal head was delivered in right occipital anterior position. McRobert, this is a yellow part, it came to me. McRobert maneuver and suprapubic pressure performed to relieve the anterior shoulder impaction. Right? Indicate the complication of gestational diabetic and associated fetal macrosomia. So 3 finding we have to say. This is the first option. Do you think it is associate? Then placenta spontaneously delivered within 15 minutes and intact. Episiotomy repaired and good hemostasis is noticed. The blood loss was 400 ml. Fundus is firm. And newborn born was 10 pound. Apgar store was 7, 1 minute and 9 at 1 minute and 9 at 5 minute. Crepitus noted over the right humerus and moro reflex is not present. So so how do I do this question? I will just click so that I don't miss anything. So I will just go make sure this is the one. Apgar store is the one. Oh, okay. So this one is the Apgar store and then it is the no reflex of Moro. So what do you think? You have to choose 3 things here. And read the question once again. Indicate the complication of gestational diabetes and is due to the high size, the macrosomia of the child. Do you think Meg-Robert maneuver and suprapubic pressure performed to relieve the anterior shoulder impaction? Do you think it's the answer? Why or why not? Discuss about Meg-Roberts maneuver. Let us do this then. How about this one? Do you think it is related? It is due to gestational diabetes and is associated because of the
Yes.
Yes, the difficult
Yes,
of
this is performed
very,
when there is a shoulder dystocia,
Shoulders
which is a
dystocia.
very
complication.
good. Now the second it was showing is this right mediolateral episiotomy and delivery posterior arm performed. Delivery of posterior arm performed. Do you think it is because of the fetal macrosomia? Or it is normal, it is not related to complication? Or it is
Looks normal.
anyone else? How about delivery of posterior arm? Is it associated with fetal macrosomia or how do we the baby deliver normally?
Normally, anterior shoulder comes first.
Okay, so we are confused between this. We will see if we can find the other two. Placenta, they didn't show. Okay, blood loss was 400 ml. Is it related to fetal macrosomia or gestational diabetes?
Yes.
Yes, because we
It's
learned that
due
big
to
baby.
large baby.
Due to large. So what is expected blood loss otherwise?
Expected
I think
Yes.
it's
500 to
less than
It's
500 it will
normal.
be.
less than
I
5.
think.
Now everybody know. Everybody is giving me that, ma'am, less than 500 is normal. But I will choose 400 because it is a fetal macrosomia.
Oh, it's not the answer.
Right? You have to pay attention because what is the problem here? You are paying attention to blood loss. You are not reading the full sentence of 400 ml. Okay, you have to. Okay, so this shouldn't be good. Apgar score 7 at 1 minute, 9 at 5 minute. Is it a complication
This
or
is normal score.
huh?
This
Is
must be
this
normal.
no? Crepitus noted over the right humerus and moro reflux is not present. Is it normal or it is a complication?
I think it's a complication of
Complication.
the.
This
It is a complication
complication.
because
This moral
now
reflex must present.
we have chosen only 2. I have Apgar store. I have blood loss. I have a right mediolateral episiotomy and delivery of posterior arm. Out of these 3, I have to choose. Otherwise, we will not go ahead.
The right mediolateral epi.
Yeah, delivery of posterior arm.
Yeah.
Delivery of posterior arm.
Posterior arm.
Let's see. Okay, let us see. Now they will give me the correct answer. Okay, the correct is 3-hour glucose tolerance test. We already knew this was the correct answer. Fetal macrosomia, shoulder dystocia, polyhydramnios. Preeclampsia is the risk. Okay, this is what we did wrong. Preeclampsia was the correct answer. Okay, Blood glucose level and need for insulin was the correct answer. This one is correct. Very good, students. CB, blood glucose level, we have to check. That is also correct. And this one is also correct. Good. Okay, now
Ma'am,
Can we
I
see
have a
the rationale
question.
for the the episiotomy and the posterior arm?
oh, okay, this one. Okay, good. Okay, maneuver to relieve the shoulder. Where it is. Okay, fetal shoulder dystocia is more likely to occur if the fetus is macrosomic. Let me show you how to. This is one. A condition often caused by poorly controlled gestational diabetic mellitus. Primary maneuvers to relieve the shoulder dystocia include McRoberts maneuver and suprapubic pressure. If needed, the healthcare provider may perform episiotomy to allow the additional space, which is expected. During the attempt to extract the fetus, fetal complication may occur, which is humerus or clavicle fracture. The nurse may note the crepitus, which we already know, over the fractured bone, decrease movement of arm, and minimize Moro reflex, which we have chosen. Following the birth, maternal blood loss is quantified, right? 400 blood loss is normal. While a shoulder dystocia increase the risk of fetal asphyxia, low Garstor, and later it is 9, it is normal. Maneuver, just give me this one, episiotomy delivery of periphery. That is, I don't think so. They explained it.
I think it's related with the shoulder
It is
dystocia
related
only.
to the shoulder because posterior shoulder, and because normally the head should come out because the baby was too large, and that is why. That is what my guess is. Shoulder dystocia, posterior shoulder, right? Sarab can answer it very well. Manveen, yes. What is your question?
Ma'am, can you please give more tips how to solve the lengthy questions because I always
Okay.
confuse in lengthy
Yes.
question.
So if you have noticed, when I was doing this question, item 6 out of 6, if you will notice as physical, I didn't waste the time in all of my question. I didn't wastage the time to read the question over and over. I read that lab result. We read in first question, and that is enough. Physical, I read it. Nurse's note, I read it. And I'm not reading it over and over again. I'm just paying attention. And when it come to progress note, if you have paid attention, it was the same 30-year-old. It was the same 30-year-old. I didn't wasted my time to read the left sided first and reread it again. Right? That is what the little things you need you can do. Or you can read the option first, that what is the three finding, or if you will go back, right? Induce which action is the priority. I don't like, let us do practice more and more question. Here it is totally, I can't explain it to you because the physical and everything, the lab result was there. I can explain it to you as we are doing the more and more case studies, right? It
Okay,
wasn't
ma'am.
that lengthy. The only thing for me, what I have given done is I didn't wasted my time reading the same two paragraph in one, right? So
Okay, ma'am.
rather you do this one. So we'll practice some other test and then we'll go from there. Okay. Okay. This question is for Veerpal Kaur. Client arrives in emergency department on cold winter day. The client is calm, alert, and oriented. The respiratory rate is 20 breaths per minute. Pulse oximeter is 78%. The nurse suspect client's pulse oximeter is inaccurate. Which factors are contributing to this reading? Veerpa.
Yes, ma'am. Mm, black fingernail polish,
Mhm.
because wrong the SpO2 pulse oximetry.
So it is you are choosing that? Are you giving me the answer or no?
Uh, yes, ma'am.
Okay.
I'm choosing.
Then next.
Not choosing.
Not this.
Cold extremities, yes.
Mhm. Then so Veerpal, and just a tip to all of you guys, because what I notice is many of the students, what you guys are doing, you're reading all the options and then telling me that is a wastage of time as well, right? So, for example, black fingernail polish, think about it. Why is it correct, not correct, or I'm confused with that? Then go with the cold extremities. Like Veerpal, you did. Yes, cold extremities is linked. WBC count. Think and tell me rather than choosing the option 1, 2, 3, 4, 5 and choosing and guessing it. There is a chance that you will do the wrong option. When you are doing it, think as you are going, moving forward.
Next, no.
Elevated WBC count. Is it linked?
No.
Okay. Hypotension.
Yes.
How it is linked? How it is linked?
When blood pressure is low, then it affects the pulse oximetry reading.
Okay. Anyone else? Okay, 4. Peripheral artery disease.
Yes.
Yes, it's linked. Peripheral artery disease is linked.
Low blood
Yes.
Okay. So Mary, what did you say? Ruby says 1, 2, 4, 5. So 1. Ruby, why 1?
Because that nail polish can alter the reading.
Black nail polish can alter the reading. Raman Kaur, you didn't choose 1. Why?
Ma'am, I was confused with the nail polish. So
Okay.
I
Do you
thought
think nail polish can hinder, like it can make the pulse oximeter reading inaccurate? Did we studied about it?
Yes,
No.
ma'am.
Yes, ma'am.
Yes, we did. Finger nail polish will hinder it. Okay, then we have 2. Elevated WBC, no. Hypotension, how many of you agree with hypotension or no?
In hypertension, there is low blood flow to the
Very good. Low blood flow. Low blood flow, there is a hypotension occur, right? So yes, hypotension can hinder the pulse oximetry, okay? Because of low pressure, the blood is flowing low. For example, you're doing it, the pulse oximeter in your toes or your in finger. Due to the hypotension, less blood circulation is happening. It is saying 78%, but actually it was going good in your brain. Right? 70, it doesn't mean that you are having low. Hypotension can happen and peripheral artery disease. Good. But the black fingernail polish is the thing. Okay. The next question is for Narinder.
Yes, ma'am.
Yes, this question is for you.
The nurse is reviewing order for 4 client with a diabetes mellitus, which prescription require the nurse to follow up with the health care provider. Okay. 10 unit regular insulin IV push. So the number 1, 10 units regular insulin IV push for blood glucose more than 250. The second 4 units, ma'am, how I can, this is a 14 unit. Which insulin? I don't know how to I pronounce it.
Yeah.
Large insulin subcutaneously. Ma'am, sorry, due to my home disturbance,
No, that
give
is
me
fine. That is
my
like,
son and everyone is surrounding me, and I don't know where I need to go.
Ma, can I take the
Sorry,
question?
no, that is fine. You can just carry on.
I
What?
just need to go inside. Give me some time, please.
Okay, sure. Manveen, let us do this question.
Can I do the
Manveen.
question? Okay. Yes, ma'am.
Yes, Manveen, let's do.
10 units regular insulin IV push for blood glucose 250 mg per dl. 40 unit. Ma'am, what's that?
14 unit glargine insulin.
Yeah. Glargine insulin subcutaneous injection every night at 8 p.m. 18-year aspart
Aspart
insulin
insulin.
subcutaneous 50 minutes before breakfast. 20 unit NPH insulin IV push every morning at 7 a.m. Ma'am, maybe one.
Okay, why?
Ma'am is IV push, so that's why.
Okay. Now let me do this question, everyone. So
Yes, ma'am.
10 units of how I will approach this question requires follow-up. Okay, that something is wrong. 10 unit regular insulin IV push for the glucose more than 250. It is very high. IV push. IV, can I do that? Insulin. I can do that, but yes, I'm confused with the push. Right? This is a question mark. I will choose it if other things are wrong. 14 unit glargine insulin subcutaneously, I know I will put it every night at 8 p.m.
Yes.
Is it something wrong? It is true. I will not,
True.
there is no question in that. It is good. 18 unit aspart insulin subcutaneously 15 minutes before breakfast. First of all, you
True.
should know what is the aspart. It is a short acting
So
one, right?
rapid
And
acting.
rapid acting one,
Yes.
and then it will act within 15. Onset is within 15 minutes, and you are giving within 15 minutes. Even if you forget it, so you are taking the insulin before the breakfast, just using, like, for example, we forgot it is rapid insulin. What is the onset? Let's forget it. Okay, is it something wrong I'm doing that I have to follow up with the doctor? Doctor, I see she took the insulin before the breakfast. Nothing wrong, right? So
True.
of course it is safe. It is true. I will not choose this over 10 and 3. If I have to choose, I will choose one. Then 20 unit NPH IV push. Administer every morning. This is also IV push. This is also IV push. You are choosing option number 1 because of IV push. But that is why you choose Manveen 1, but you didn't pay attention. Fourth is also IV push. There is one correct out of these two. One is insulin IV, another is NPH IV. Now I have to apply the knowledge. I don't know, can I give the push, but 1 and 4 cannot be correct. I have to choose one. Now apply the knowledge. What did you know about insulin and NPH? Which one you will give IV?
Regular.
Regular.
Never injection and
NP is never IV,
Yes, ma'am.
right? So don't pay attention to IV push. IV push was written in 2 sentences,
Yes, ma'am.
right? Are you getting my point? So that is
Yes,
what
ma'am.
a simple mistake. So even if you forgot it, so don't blame that I forgot about the insulin. That is why. Blame it that I was paying attention to this one and then I didn't pay much attention. The problem why, that is why I'm telling you, the students who are reading all the 4 options together, there is a chances that they will choose the wrong option because for example, when Manveen was doing the question, excuse me, Manveen, everybody was giving me the same answer, the 1-1, right? But I'm just giving the example. She liked IV push, right? In her mind, she already chose the option IV push doesn't look good to me. And then when she started reading 2, 3, 4, because she mentally, subconsciously, IV push was wrong to her, she didn't pay attention about this IV push. Okay, so that is very normal and most of students do this mistake. Okay, so let
Okay.
us do, was it the correct answer? No. So 20 unit IV, NPH is never, never IV. Okay, but good question, Manveen. Thank you for doing the mistake. Okay,
Thank
I
you,
will
ma'am.
give you
Sorry.
marks there.
Yes.
Yes, because that is what I'm looking for. Okay, the next question is for Ruby. Let's do you. Ruby.
Yes, ma'am.
Okay.
The the clinic nurse evaluate a client's response on levothyroxine after 8 hours of treatment. What therapeutic response to the medication should the nurse expect? So after giving levothyrox, what we have to expect? Select all that apply. Apical heart rate 88. No, because levothyroxine is the medication that we give for the hypothyroidism, so it will increase the heart rate. And elevation of mood, yes. And improve energy level, yes, it will.
Did you choose one or not?
No, ma'am. Skin is cool and dry. No, they are like, if after getting medication they can feel hot. Slight weight gain, no.
Okay. Anyone has a different option? Shama choose 1, 2, and 3. Shama, why 1?
Usually the patient who is in hypothyroidism, they have their sign and symptom is bradycardia.
Yes.
But his her heart rate is improving. 88 is normal.
Yes. Now, very good. So she is on levothyroxine, right? Is thyroid gland only related to mood, only related to energy level? No. It affects all the body organs. Does it affect the heart rate? Yes. Due to hypothyroidism, the bradycardia was expected. Now it is normal. It is expected. Nurse expect the normal heart rate. Nurse expect the mood is better. Nurses expect energy level is improved. Now, another thing what we are learning, because elevation, improved words is making you feel that yes, there is some improvement, right? They didn't wrote here that the heart rate is improved. That is what is making that okay, that is fine, I don't know, there isn't, and you are not even thinking that if it is related or not, right? So be very careful. Yes, the heart rate is related to it is normal right now, which is due to levothyroxine. Okay, let us see. Yes, okay, that was the correct answer. Shama, let's do this question with you.
A nurse working in the office of a healthcare provider must respond to client telephone message. Which client should the nurse call first? Client with a left humerus fracture, reporting stiffness and limited range of motion in the left shoulder. To client with a left shoulder sling due to fracture clavicle, reporting vomiting after taking oxycodone. Client with a right leg cast applied yesterday for a fracture ankle, reporting tingling in the right foot. Client with fibromyalgia, reporting on relief burning pain and prescribed an amitriptyline 1 week ago. So I have to think.
I think this one is one of the clear question. So what is your answer? Everybody who give me the answer, good job. Good answer.
3, due to compartment syndrome.
Sorry, Shama. Shama is giving me the answer. Shama, tell me.
Client with I'm confused in 1 and 3.
1 and 3. Okay,
Limit,
why? I have
like,
to ask why. Why there is
client.
1? What is confusing? That ma'am, 1 is due to this, 3 is due to this.
Okay. Client with a left humerus fracture reporting stiffness and limited range of motion in the left shoulder. Okay. Client with a right leg cast applied yesterday for a fractured ankle, tingling in the, I think 3, ma'am. Because I was confused, like, yeah, there is written humerus. I was thinking about ear embolism.
You were thinking about?
Ear embolism, but but in 3 there is written tingling
What is
sensation.
ear embolism? Why are you
Sorry,
thinking this one is-
fat embolism or ear embolism?
Yeah, so what is thinking that fat embolism is emergency?
Yeah,
Which word is telling you that it is a fat embolism?
like left humerus fracture.
So humerus means fat embolism.
Sometime it can happen, but there
Okay,
is
so read the full sentence. Is it linked toward the fat embolism?
no. That's why I think 3 is the answer.
Okay, so I just wanted to make sure this is the biggest mistake students are doing. Thank you for doing this mistake.
Okay.
Now, what happened is, I know everybody, the correct answer is 3. Everybody knows that this is a compartment syndrome. Now, the student who is thinking that, ma'am, left humerus fracture, this is ear embolism. What is the problem here? The problem is you are not even paying attention to the full sentence.
Yes.
Fat embolism, what is a sign and symptom of fat embolism? Only fracture, that is all? All the humerus fracture is fat embolism? What is fat
But
embolism?
the remaining sentence of the question
just so what is happening? You have to ask, what is happening? Is he having the sign and symptom of embolism?
No.
Shortness of breath. Did they said कि shortness of breath and etc. is happening? Chest pain is happening. Petechiae is there. How are you going that? Just humerus fracture? Because I read it somewhere. There are long bone fractures. It is a risk factor of fat embolism. I don't read any other sentence. Just humerus. That's all. Humerus fracture and he's not moving his arm. That is what they're saying. Fracture, that is expected. He can't move his arm. It has nothing to do with the fat embolism. Don't assume the half thing and then diagnose yourself, right? And that is very common. This is just because this one was very easy. Everybody of you guys know compartment syndrome. 3 is the answer. But let me tell you, if compartment syndrome is not there, that is very common thing the student make mistakes. So don't do that. All right. Dilpreet. Next question is your Dilpreet.
Yes, ma'am. Which pediatric respiratory presentation in the emergency department is a priority for nursing care? Option first is client with an acute asthma exacerbation but no wheezing. Client with bronchiolitis with low grade fever and wheezing. Client with runny nose with seal like barking cough. Cystic fibrosis, client with fever and yellow sputum. Acute with the Ma'am, I'm confused in between second. I feel like it's second because they said it's wheezing. So I think something is stuck. Like inflammation of the maybe airway problem. I'm not sure about that. But I feel
That
like
is
second
fine.
is the answer.
Okay. Wheezing, what is called, what wheezing is happened because of?
Inflammation, ma'am? Like
What is, yeah,
obstruction?
yeah, inflammation. What is the diagnosis of this patient?
Bronchiolitis?
Bronchio?
Something.
Bronchio something? No. Tell
Oh,
me.
no,
Read
no,
the
no.
sentence.
It's okay. I thought it's,
No,
yeah.
read the sentence.
A client with bronchio, it's litis with low grade fever and
Okay,
wheezing.
bronchiolitis. What
Yeah.
is itis?
It's inflammation, right?
It is inflammation. Wheezing is happening with inflammation. He is already having inflammation.
Yes.
Is it expected or not?
It's expected, yes.
Got it?
Yes, ma'am. Okay.
Yeah, so please make sure you're reading the sentence fully. Okay? And you was confused with what?
Ma'am, I just think it's wheezing, and in the first there's no wheezing, so I just put my focus on wheezing. I was like, oh, there's some obstruction in airway, so maybe he can't breathe or something.
Okay. Now, Dilpreet, did you attended my respiratory classes?
Yes, ma'am.
Okay, Dilpreet, what is happening with one? So that is another, students, please pay attention. So what mistake she did? She didn't read the sentence. She said no wheezing and wheezing. I will choose wheezing. Let me tell you, today one of my student passed. Her name is Janet, right? She passed today. So I did her assessment couple of days ago. You won't believe that, like, I was doing the question, she scored only 20%. And I was like, Janet, that is not good, because what is happening, the problem she was doing, she was just reading the option, just like you did the mistake. Wheezing, wheezing is a problem, no wheezing is not. And then she wasn't reading the sentence, just focusing on one word. And she was like, literally, I was saying that you won't pass, Janet, like if you will do like that. NCLEX is about the critical thinking. It is not the English language that you have to pay attention to one word and make up the stories. No wheezing, and you didn't even pay attention what is happening. No wheezing means absolutely is fine. And wheezing means something is wrong. Even you didn't read the, what is the diagnosis of this patient. That is what. So, what my advice, the only thing is that I told her that you are very intelligent, everything is good. This is the problem, that your scores are not improving because you are not reading anything, reading some words and thinking that this is the answer, which is very, very problematic. And thankfully, because she just did the assessment and she was able to know, okay, that is what she was like. We had a call this morning and she was saying, like, I was literally very conscious and I was making sure I'm reading every single word of the question, and she passed in 85 question. The same girl who was scoring only 20, 30, 40%, she must have scored 80% or high, like in yesterday's exam. And why I'm telling you guys, because this is very common. It is not that Delpreet has done this mistake. Many students are doing. And it is number one reason behind the failing result. Now, Delpreet, the same thing you are doing. The
Yes,
client
ma'am.
with acute asthma exacerbation. What is asthma? What is asthma? Delpreet, are you there?
Yes, ma'am.
Yeah. So what is asthma?
Um, ma'am, it's inflammation of the muscles.
Yes. Yeah. And exacerbation means, what is exacerbation? In a simple word, asthma exacerbation is what? Worsening or improving?
Worsening.
Like asthma is worse. and he's having no wheezing. Why there is no wheezing?
Maybe a side.
Maybe. What has happened?
But maybe it's worsened. Maybe it passed the stage of wheezing. That's like complete silence.
What is the reason of wheezing? Wheezing is when there is a swelling over
Yeah.
the walls and then there is a passage of the air through the narrow opening. That is causing the wheezing, swelling. When there is too much blockage, when it is so much swollen that there is absolutely blockage, will you hear wheezing?
No, that's complete
No.
silence.
So that is danger. Danger. That is
Emergency.
medical emergency. He's exacerbation and not using. Bronchiolitis, inflammation is there and wheezing.
Yes.
It is expected.
Yes.
Client is runny nose with barking cough. He's coughing. Like I am comparing that he is coughing and with the someone whose blockage, airways blocked. One is the answer.
Yes.
Okay, everyone, Lovedeep, understood? So you choose this one, which is never, this is not the option. Okay. All right, we'll do one more question and we'll go from there. Amandeep Singh.
Ma'am, Amanpreet Singh.
Amanpreet Singh. Okay, Amanpreet, let's do this question.
Yeah, ma'am. The nurse cares for a child with the bed bug bites. Which parent statement indicate that further teaching is required? First option, I need to have the entire house treated by pest control to ensure the bed bugs are gone. Second, I should concentrate on elevating scratching as it can cause further complication. My other family members and pets are at risk of bed bugs bites. Fourth, this must have happened because I did not wash the bed sheets this week. So,
Yep. What do you think, Aman? So another, let me tell all of you guys, I am keep on repeating myself that the students who are reading all the four options, there is high chances that you will choose the wrong options. I think I have told you many times. Aman, you are still doing the same thing. Try to give me the answer. Read the first option and
so
see
first,
if it is
yes,
linked with that or not.
I need to.
Do
So
that.
it's a true. First one is true.
Further teaching mean you are looking for
We are
the
looking false.
false. So I need to have entire house treated by pest control to ensure bed bugs gone. It is true.
Yeah.
How about second? How about second?
So, I can like third one is true. I'm not sure about second yet.
Okay, we will think about it. My other family member and pets are at risk of bed bugs, which is also true. Okay, good. Okay, so second, let us read the question or option before we cancel it and we will read the four. What is the full sentence? Read it.
I should concentrate on elevating scratching as it can cause further complication.
Alleviating means, what is the meaning of this word?
Decreasing. Decrease.
Alleviating means not, that is what the NCLEX sometimes love testing your English. Alleviating means
Avoiding.
Avoiding like this.
So, Aman, do you think if avoid the scratch because it can cause further complication, if you will do the scratch, can it cause the complication? And what kind of complication?
No, ma'am.
Broken.
It's not. No, ma'am, because like if we don't do scratch, like bugs can also come.
What is scratch? Do you know what is scratch? I'm doing scratching right now.
Yes, scratching. Like, is he talking about like a body or scratching on the
Scratch
back?
means body scratching.
Okay, okay. I'm just thinking about the like wall scratching or something.
Was no, no, no. Scratching means you are scratching your skin. So you should avoid scratching because it will cause complication, or you should do scratching. Can it cause a complication?
If I do a scratching.
What kind of
Yeah,
complication do you think
it
of?
can cause complication. It
What kind
can
of complication?
like damage to skin.
Damage to skin. So
Like
you should avoid doing that or not?
we should avoid it.
We should avoid. Okay, what is the fourth option?
This must have happened because I do not wash the bedsheet last week. Yeah, it may be true
Why?
because it's saying about last week, not like a
Uh-huh.
long time ago.
Uh-huh.
So
So means what is like so long time ago? What so if you will not wash your sheets, so bed bugs will come.
no, ma'am. Like not for a week. Sometimes it happens, but if we don't do it for a long time, it must
Uh-huh.
be happen. But for it's talking about last week.
Okay, so Aman, are you? I'm sorry, are you on student visa or are you
I change in
living
work,
with the
ma'am.
family or so?
No, I'm on work visa.
Work visa. Aman, you are a boy and you're on work visa. How often you wash your sheets,
Like
especially the boys?
every week.
Every week, that is good. But because not everybody wash the sheets, right?
No.
You must be having
While I'm
due to what?
student, I'm not watching like every week. I'm like months, but
Some
now
months. So did you have bed bugs?
I never seen that, ma'am.
Yeah. So
No.
do you think what is bed bugs? Just a thing. So like let us suppose because we never learned the bed bugs in our classes,
Yeah, ma'am.
right? Most of you nine knows what is bed bugs. Let's say that I haven't seen bed bugs is a insect.
Yeah.
Yes. So the insect will come if you didn't wash the sheet in 1 week.
No, ma'am, this is not going to happen.
So is it linked with that not washing for long time, maybe thinking just within 1 week the insect will come? That is what you think? Further teaching. So I have to choose between um this one. You are thinking I have to choose between 2 and 4. All right. So what do you think that what is the safest thing? I know that I will not do the scratch. I'm not sure about the week. So what is you are going to do? Further teaching, which is wrong. Should you
So
avoid? So based on
fourth
that.
one,
The
fourth one,
fourth
ma'am.
one. Okay. So based on that, choose what if you don't have, maybe you don't have the knowledge of this one, but you have the knowledge that I don't want to void the skin because of the skin will get, like skin infection or the skin injury can happen. All right, let's read the option rationale. It is a common misconception that bed bugs are drawn only to the dirt environment. They can exhibit any environment and can travel and spread easily in clothing, bags, furniture, and bedding. Although they do not pose significant harm, bedbugs can cause itchy red rashes that can be uncomfortable and can affect the sleep. Bedbugs should be exterminated and especially in the home. It is important to treat the entire house for the bed bugs. Washing the pillowcase, blanket will not stop the infestation. They will not kill it. You will wash the sheet and bed bugs are all gone. It is not that is what it is. It will multiply quickly and can hide in anywhere, not only in the bed sheet. Okay. Bed bug bites can cause rashes that client, especially children, will be inclined to scratch. So please, precautions should be taken to alleviate the rash because it can cause the complication, skin infection. Once a home is infested, the bugs can travel quickly and occupy the space and services. All the household member and pets will be afflicted. So that is what is the correct answer, the 4. Okay. All right. So that is all for today. I hope you have learned something from today's lecture, because we did a lot of mistake. We tried to think that how others are thinking, and you was comparing it with yourself, that I was thinking that 2 is the answer, but maybe Veerpal has gave a good explanation on the option number 2, right? Oh, I never thought about it. So try to come on the blitz days, right, as much as possible, so that we are learning from each other. Okay. Yes, Mary?
Ma, I actually have a question. So, what is in a case whereby you come across a question and you don't know anything about it, like,
So example, that is what I'm trying to. So for example, bed bugs, right? So we did couple of questions, Mary. I was trying to tell that we will practice that. If you, even if you don't know anything, you have to cut it short. For example, the question I think Veerpal did, bronchodilators, right? She didn't pay attention to, just imagine bronchiolitis, she didn't knew, and wheezing, she didn't knew, right? Just cut the diagnosis in a half, try to see that what it is related to. Now, bed bugs, it is insects. Yes, it can cause, maybe you don't know about the bed bugs at all, but you were still able to do this question because you know that I will scratch, there is infection. It has nothing to do with the bed bugs knowledge, right? So, Mary, that is why I'm just paying attention that read all the options and think, and you will get to the correct answer, even if you don't know about the topic. We have covered many questions today. We get many random things, right, which we have never heard before. We, right? So those questions, the more questions you will do, the more practice you will do, that will be better. And also I will discuss with you that what to do when you have absolutely no idea that what is this, and you can't even guess within the
Yes.
options.
Yes.
I am going to discuss those strategies for my next class.
Okay,
Right? I
ma'am.
am going to teach you the strategies. Strategies means that time when you are stuck. Right? So that is why I don't want to explain those techniques today. We are practicing the questions, right? And I will explain in detail with those questions in my next class. Mary, so you have to come. Okay.
okay.
And I will start my strategies from Wednesday, June 9, July 9. All right. So
Ma,
strategies is very important.
yeah, what about the will you about the foundational, like, fundamentals of nursing?
And yes, we will cover. We will cover the strategies, and then I am going to do the grand miscellaneous topic where we will learn the management, where we will learn the living will. You were discussing about the living will, power of attorney, those kind of question. I think Shama was giving sending the questions.
Yes, ma'am.
I was reading those one. You guys are correct, but don't stress it out. I will cover each and everything.
Okay, ma'am.
Okay, Mary. So there is no topic which is uncovered. We will do the fundamentals. Basically, I did cover most, like how to apply the NG tube, how to, do the puffers, how to inhale the nasal spray. I did it most of the time, like tracheostomy care of how to do it. We have done it. But there are fundamentals and ethical principles which which you must know, right? We will cover it.
Okay.
Okay, Mary?
Is there
Okay.
any class tomorrow, ma'am?
Saturday, Sunday, we are off, Shama.
Okay.
Yep.
Thank you, ma'am.
Okay. Yes. Okay, students. So that is all today. And I will try to take, after the strategies, I will try to do my best to do more blitz classes. Right? Please try to join it. That is very important for you guys. Okay. All right. And Sharon, yes, before I leave, what is your question?
Ma'am, can I apply my ETT now?
Of course, Sharon, if you haven't applied it, you have to.
And
It
after
is ATT means that you have to write the NCLEX exam in next 6 months. I am surprised that's for the student who didn't apply the ATT. It means that you don't want to write. Because if you don't want to write in next 6 months, you will forget everything.
okay,
You
ma'am.
will forget everything. So now you are studying. Please apply the ATT. Anyone who didn't apply the ATT, it is a really not good thing. Okay,
Okay,
please
ma'am.
do apply it. Okay, yeah. Okay, anyone else? All right, student, we didn't have the break yet, but that is all for today. And I will see you in next week with the strategies. And I want your full attendance, 100% attendance on Wednesday. Okay. All right, everyone. Good night.
Thank
Thank
you,
you.
ma'am. Good night.